can you please give everyone a brief introduction of who you are, what you do at Union Hospital?
Great. So I'm Dr. Yannie Soo. I myself was a doctor as well. I'm a neurologist, so I'm a specialist in brain and nervous systems disease. Well, first of all, I really would like to thank you and Media Zone for presenting this award to us. So whenever we talk about medical services, we always think about doctors and nurses. But actually, there are a lot of people behind the scene to get everything working efficiently and safely for a hospital. And these are all the staff behind, like Vivian, we have it with us today, and Gaming, they are chief pharmacist and IT technologists. They're really the key person to keep a hospital running safely and efficiently. Yeah.
Could you give us an overview of what the Hong Kong health industry is like today? And has there been a surge in demand for private healthcare services after COVID? What's happening?
Yeah, so actually this year, Hong Kong ranked 12th as the best medical services around the world, which is very impressive, given that we have a very low tax rate, that the healthcare expenditure accounts for 8.5% of our GDP, with 60% funded by the government and 40% from the private sector. So currently, the healthcare medical system is shared between two pillars, majority by the public healthcare sector under the hospital authority, which shoulders more than 90% of the inpatient healthcare, which takes care of patients with more critical illness, while the private sector, like the Union Hospital, which mainly take care of the outpatient patient care, which accounts for around 70%. Well, talking about the healthcare system in Hong Kong, we actually have benefited a lot, because if any one of you has ever tried using the public service, you would realize that they are very affordable. Well, I'd like to ask you, imagine or guess how much it costs to stay in the hospital for one day, in a public hospital.
In a public one? It's about 100? 120?
Yes, $120 Hong Kong dollars, and that includes everything. Includes your 3 meals, the doctor's fee, all the drugs that you receive, all the scans, and all the surgeries that you received. So it's just $120 today. And it costs only $16 to get a drug prescription that lasts for 4 months. It's less than half the price for a cup of coffee. So these are really the benefits that we receive from the government, which is very generous. But it's exactly because of this reason. The flip side of the story is that it's getting overloaded in the public sector, that it takes longer and longer to wait for new appointments. It often waits for more than a year to get a new appointment. It takes for many months to wait for an MRI scan and to get the surgery done. And that's because of the aging population. We need a lot more resources to take care of the chronic illness and the complications. And this improves and increases the demand for both the public and the private healthcare sector. And that's why in the recent years, in 2019, the government has introduced the voluntary health insurance system, encouraging the public to use more of the private hospital services and rely less on the public sector. And there are also a few more public-private partnership programs that allows certain surgeries that needs to wait for a long time in the public hospital, like the knee replacement surgeries and the cataract surgeries. So these surgeries some of them can be done in the private hospital with subsidy from the government. So all these added up together has increased the demand for both public and private medical services in Hong Kong.
I understand that Union Hospital has brought in some new technologies, which you're here to show us today. Can you take us to your booth now and show us what it is that you have and how it can benefit, the healthcare of Hong Kong?
Sure. So Union Hospital has actually almost 29 years of history. And for all these years, we have actually evolved to play a very crucial role providing comprehensive medical care service into Hong Kong. And all along, we have been using different technologies to enhance patient safety. So among all these, we have brought 2 of them that is most related to patient care today. One of which is this drug recognition app, which I'm going to show you with this PowerPoint. So if you have ever been to a hospital, you would wonder why it takes so long for you to get your drug after you leave the consultation room. Very often it takes an hour. It's because it's actually a very lengthy process for us to make sure that we got the prescription order from the doctor, which arrives correctly to the pharmacy, and then the pharmacists get the right drug from the drug cabinets, which store over hundreds of medication to get the right one to give us to the patient. So it's a very lengthy process, and it's time-consuming to make sure that every step is is done correctly. So we realized that it's very time-consuming, and during the busy day, it inevitably might lead to human errors. So we have developed this mobile app called the Drug Recognition app. So using the optical character recognition technology, our pharmacists will use the mobile app here, as you can see. So they will have to scan two things. First is the drug label from the drug package, which carries information about the name and dosage of the drug that the doctor would like to prescribe, for example, Panadol, 500 milligram 4 times a day. And then they have to scan the information on the drug package that they got from the drug cabinet, which can be either a barcode or a registration number, which reflects the information of the box that the pharmacist is carrying it, to make sure that the drug the pharmacist gets from the drug cabinet matches exactly as what the doctor is going to prescribe. There are many drugs that have similar names, and with the same type of drug, there can be different preparations. Some came in 100 milligrams, some came in 200 milligrams. So we have to make sure that everything is correct. So with this app here, we can match the prescription information from the doctor and the drug information from the box, so to make sure they match exactly well. So if they match, it will give us a green light, and if they don't, it will give us a red alert, so that the pharmacist will go get the right one instead of getting the incorrect one. So this is one of them. So the next one is also about drug. So for every patient who came to our hospital who get the prescription, if they have downloaded the Union Hospital app, there's actually a feature called the medication list. So where there we can see all the medication that the patient get on that day, and which includes a picture of the pill for every drug, so that they can recognize what drugs and the names, they can match them well. And you click into individual drug, there will be detailed information about the drug, how you should take them, whether you should take with meal, and what are the common side effects. And there are some drugs that are a little bit trickier to take, for example, some puff, or which you might need to use devices. We've also included videos in there to demonstrate how the patient should use the drug at home. And also there is another important feature, which is a set alarm feature. So just by clicking into that, it would list out the time that you are recommended to take those drugs, and if they don't fit with your schedule, you can actually slide them across to adjust to a schedule that fits into your work or daily schedule. So it's really very customized. So it really enhances not just the safety of our patients in getting and taking these drugs, but also improves the compliance to these medications after they go home.
Wow, so this really takes medication to the next level.
Yeah.
Because you don't get these things with Hago and all those apps, right?
Yeah, that's right. So, and we recognize all these needs and these pain points when we manage our patients, and these are all This is actually all our innovations by our in-house pharmacists and our IT staff that helps bring all this up to our patients.
Okay. I heard that Union Hospital also established some smaller centers. The healthcare centers?
Yeah.
Can you tell us about that?
Sure. So as I've said, we have almost 28 years of history, but in the recent years, we have extended our catchment beyond Taiwai, where the main hospital building is. We have extended our catchment to 2 strategic areas in Tsim Sha Tsui. One is at the Mirror Center. The other one is at H Center, which is located right next to Sheraton Hotel. So there we have a number of medical centers, including a day procedure center, reproductive medicine center, imaging center, as well as cancer center. So nowadays, the patient experience is very important to us. Receiving medical treatment outside the hospital is actually a lot more convenient and comfortable for the patient, particularly for cancer patients. So nowadays they can receive the chemotherapy as well as radiation therapy outside the hospital in Tsim Sha Tsui, which is really convenient to them. These are tough treatment that our patients are going through. And imagine while they're receiving the chemotherapy, their drips, they're actually sitting next to the window, enjoying the view of the Victoria Harbour and the K11 Museum. So it feels more like they're having a vacation in a hotel rather than receiving medical treatment in a hospital. So these are what we have been doing to enhance our patients' experience during the medical treatments.
Okay, so now we're approaching the new year. What can we expect from Union Hospital in terms of innovation? Are you guys going to open any more new centers? What's happening?
So actually, our ancillary block in our main hospital is coming up, and it should be ready by February next year. By then, we are going to have 46 more single semi-private rooms, which is we expect that it's going to be in high demand because this is a category of room that is covered by private insurance. And in contrast to most other semi-private rooms, which are shared between 2 to 4 patients sharing toilets, this single semi-private room is only for a single patient having their own toilet. And yet, it's mostly covered by most insurance. So it's more like a premium economy class of rooms that is going to be very, very in high demand. And on top of that, we're going to have another new operation theater. We're expecting more space in there that we're going to have robotic surgery equipments. And also, in terms of technology, we have recently started using AI for preparing our surgical instruments. So actually, before every surgeries, our staff will have to prepare a tray of all the instruments, there are a lot of them that will be needed during the surgeries. And imagine if you have to get every one of them by human, getting one of these from this cabinet and the other one, and they all look very similar. It's very time consuming, and there can be human error as well. So nowadays we're using AI technology. So putting all the instruments just under the camera, it can automatically identify which are the ones that that's already on the tray and which are the ones that are missing, and it track and lock all these instrument sets. Again, improving safety and efficiency for the operation the operation in the operation theater. And another new gadgets that we are going to have is, again, related to drug, is a smart drug cabinets, again, which is going to be placed in the operation theater. So it's like a huge refrigerator where we have, which we can store over 100 types of medication. Because during an operation, actually, our patient might often need some ad hoc medication that need to be given. And usually, conventionally, it needs a lot of cross-checking between staff to make sure that the right drug is given to the patient, particularly in terms of drug allergy. So now with this smart drug cabinet, our staff will only have to go into the cabinet, use a fingerprint to lock in, and then key in the drug that would be needed, and then it will automatically cross-check the drug allergic history of the patient, which is already in the hospital system. And then within a few seconds, the drug that you will need is like a vendoring machine, will be available in one of the drawer that will be opened up. So it's really convenient, it saves times, and most importantly, it really enhances the safety during a busy operation.